Hi everyone, I am Shivakumar, Department of Pharmaceutics, Sri Shanmugha College of Pharmacy, Sangagiri, Salem. Today we discussed about posology. Posology. The introduction of posology. The word posology comes from two Greek words, posos meaning how much and logos meaning science. Essentially, it is a branch of medical science that deals with the specific quantity or dose of a drug administered to a patient to get the desired healing effect. The dose of a drug cannot be fixed because various factors influence it, such as age, sex, and severity of the disease. The official doses mentioned in pharmacopoeia represent the average range of quantity suitable for adults and are generally administered orally within 24 hours. When the other routes of administration are followed, the relevant appropriate dose is given. There are 16 different factors that a pharmacist must consider when calculating a dose. These range from basic biology like age, sex, body weight, to the drug is given like route of administration and the time of administration. We also look at complex reactions like synergism, tolerance, tachyphylaxis. Let's more explore the most important ones in details. First factor, age. Age is a critical because our bodies process drugs differently over time. The pharmacokinetics of many drugs change with age. Uh, First, infants. Infants, nothing but newborns, are extremely sensitive. Their livers are their livers and kidneys aren't fully proper developed yet, so they can't clean out or detoxify drugs well. This can lead to toxic accumulation in their tissues. And elderly patients. Elderly patients, on the other end, older patients are also more sensitive. For example, simple sleeping pill that works fine for a young adult might cause confusion in a elderly patient. Next factor, sex. Gender plays a role too. Women often respond differently to drugs than men. We have to be especially careful during menstruation, pregnancy, lactation. First, menstruation. Avoid strong laxative like aloes. And next one, pregnancy. In pregnancy, certain drugs can cross the placenta and affect the fetus, such as alcohol or barbiturates. We also avoid drugs like ergot alkaloids that might cause uterine contractions. And at last, lactation. In the lactation, some drugs like morphine or tetracycline can pass into breast milk and harm the infant. Next factor, body weight. Doses are calculated as mg per kg of body weight, while an average dose works for people between 50 to 100 kg. It might not be safe for someone who is obese, severely malnourished, or a child. In this case, we must do specific calculation based on their exact weight. Next, route of administration. The way a drug enters the body changes its strength. An intravenous, that means IV, dose is usually much smaller than an oral dose because it goes directly into the blood. However, the IV route also carries a higher risk of toxicity if not handled carefully. Time of administration. The presence of food in the stomach delays drug absorption, whereas drugs are rapidly absorbed from an empty stomach. After meals, we give drugs like iron or cod liver oil after eating to prevent irritation. Before meals, antacids are best taken before eating to coat the stomach. The presence of food in the stomach delays the drug absorption, while drugs are rapidly absorbed from an empty stomach. However, this doesn't mean that drugs are ineffective when taken during a or after meals. Iron, arsenic, and cod liver oil should be given after meals, whereas antacid and drugs should be taken in before meals. Next one, environmental factors. The personality and behavior of a physician may influence the effect of drugs, especially those intended for psychosomatic disorders. Female are sometimes more sensitive to lower doses due to emotional factors. We also use placebos, that means innate fake pills that look like medicine. These can actually help patients with conditions like asthma or chest pain simply through the psychological benefit of taking medicines. Next, presence of disease. If an organ is not working, the drug not have behaved normally. For example, in liver cirrhosis, the drugs like barbiturates last way too long because the liver can't break them down. In kidney failure, the drugs like streptomycin can build up to toxic levels because they are not being filtered out of the body. Next, accumulation. Some drugs are slow movers. If you take them repeatedly for a long time, they build up, accumulate in body because they are excreted very slowly. This can lead to poisoning or toxic effects. Examples, digitalis and heavy metals. Next, addictive effect and synergism. When we mix drugs, two things can happen. One, additive effect. 1 plus 1 equal to 2. The total effect is just the sum of the two drugs, like using epitrine and aminophylline for asthma. Next one, synergism. 1 plus 1, 3. That means 1 plus 1 equal to 3. The drugs help each other to work better than they would alone. For example, adding adrenaline to procaine makes the numbing effect last much longer. Next, antagonism. Antagonism is the opposite. One drug blocks another. This is a lifesaver in poisoning cases. For example, milk of magnesia, that means alkaline, is used to neutralize acid poisoning. Another example is how adrenaline is acetylcholine cancel each other out because one narrows blood vessels while the other widens them. Next one, idiosyncrasy. The idiosyncrasy is nothing but it's also called as allergy. This is an abnormal or unexpected response to a drug. For instance, a tiny bit of aspirin might cause internal bleeding in some people, or a patient might have a severe life-threatening reaction to penicillin. Next, tolerance. Tolerance happens when a patient needs a larger and larger dose to get the same effect. We see this often with smokers and nicotine or alcoholics with alcohol. The drug tolerance is two types. One is true tolerance and pseudo tolerance. First, true tolerance. The true tolerance happens whether the drug is swallowed or injected. The pseudo tolerance only happens when the drug is taken orally. Tachyphylaxis. This is the rapid tolerance. If you give doses too close together, the body's receptors get blocked and the drug stops working. Even if you increase the dose, it not help. The example, the repeated administration of epitrine at short intervals in the treatment of bronchial asthma may produce a markedly reduced response due to the tachyphylaxis. And last one, metabolic disturbance. The body's internal state like temperature or electrolyte balance can change how a drug works. Take salicylates like aspirin, they will work only lower your temperature if you have a fever. If your temperature is normal, they not lower it further. That means the body temperature and have no antibiotic effect when body temperature is normal.